We're having a real heart-to-heart discussion on today's episode of Health Accelerated, brought to you by OSF HealthCare. According to the Centers for Disease Control and Prevention, heart disease is the leading cause of death in the United States for men and women across racial and ethnic groups. Coronary artery disease affects more than 20 million adults over the age of 20, and more than 6 million adults have heart failure, which accounts for about 8.5% of all heart disease deaths. The heart transplant program at OSF HealthCare St. Francis Medical Center in Peoria is the only one of its kind in central and downstate Illinois. Joining me to discuss heart transplantation and more are Dr. Barry Clemson, heart failure medical director at the OSF HealthCare Cardiovascular Institute, and Dr. Emmanuel Almiraj, the heart transplant surgical director at OSF St. Francis Medical Center in Peoria. Let's get started with what we mean by heart failure. What is heart failure?
Heart failure is a disease that progresses. And so when we really are talking and thinking transplant, it's because the disease has worsened despite medical treatment. The patients are much, much more symptomatic. They can't do any normal activities. They get short of breath walking 10 or 20 feet. They can't go up the steps in their home. They get admitted to the hospital multiple times because the fluid builds up or because their blood pressure is too low. And then they start to have problems with their kidney function, liver, and then you know this disease has progressed to the point that without transplant or some intervention, they will not survive much longer.
They've run out of options.
So they've run out of options and they need a transplant.
We wanted to do a little history lesson on the heart transplant program in Peoria. It is a program that traces its origins back to 1987 when OSF St. Francis did the first heart transplant into Doris Thomas. She was 55 at the time. She's now 91, and I would guess she has exceeded all expectations and then some.
If you look at the average survival after transplant, it's far better today than it used to be, but it's probably on the order of 14, 15 years. So she just had her 36-year anniversary. So yeah, it's surprising. And it's also surprising because it was the first one done in central Illinois. So you wouldn't necessarily think your first one's going to live, 3.5 decades. But she's done remarkably well over all of that time with very little complication of any sort. Now, she's got some health problems that you would expect at 91, but that said, it's still pretty good. And also, we're pretty sure she's now the longest surviving heart transplant recipient that only had one transplant. There's some that have had multiple transplants and have long survivals, but we think she's the longest survivor on one organ in the world.
Who is a good candidate for transplantation, or is there no one set of circumstances? I mean, how do we determine who's going to get what, or again, is it a case-by-case basis?
I think the simplest way to put it is fairly healthy other than the heart, age probably less than 70 these days, and then if they do have other illnesses, they have to be stable. So diabetes has to be controlled. Kidney disease can't be too bad. Liver, likewise. Lung disease, emphysema, COPD, can't be too bad because these are people who have to be able to recover and live 20 or 30 years maybe. They can't have cancer unless it's remote, because when we try to protect the heart from rejection, those drugs can actually cause cancer in some cases, and certainly if somebody has cancer and is being treated, you can't do that. You can't suppress their immune system.
Let's talk about the young man who benefited. He was younger. I was surprised, that first patient. I felt like he was younger. And how's he doing?
He actually came in at the beginning of COVID, so we thought for sure he had COVID because he was very, very, very sick. And we tested him many times, so that wasn't part of the equation. I think he was 22 at the time. He required many of the devices that Dr. Almiraj talked about to support him to work on, get his lungs clear, his kidneys, liver, all that stuff. So once he stabilized, we actually did put him on an LVAD because we really weren't sure what was going to happen to his heart. So he did get an LVAD and he went home. And then over the next 6 or 12 months, whatever the time frame was, then he stabilized real well at first, but then deteriorated, and mainly because the right side of the heart started to fail. And he ended up coming back in the hospital pretty ill again, required support, and then we listed him for transplant. He has done absolutely amazing. He was a runner and very physically active. I know within 6 months of his transplant, he did a 5-mile run. He works full time. He's very vigorous. He's just living life to the fullest.
But that goes back to even the components Dr. Almiraj mentioned about and even you did, the recovery and the mental part of it. Because you're early 20s. You come in and you're like, what do you mean I have to get a heart transplant? And all of a sudden this has happened. And so it's exciting to hear that he's doing well. And it has changed his life.
Oh, for sure.
Absolutely. Saved his life.
Saved his life.
Dr. Emmanuel Almiraj, our surgeon, and Dr. Barry Clemson, head of the Heart Failure Program. It's been a very enjoyable and educational conversation. Thanks for being with us today.
Shelley, thanks for having us. It's great.
Thank you.